Hi, and welcome back. In our first two presentations, we went through the basic concepts of gamification and had some examples of how games have been used in the field of mental health. Now we will discuss more details about gamification and collaboration within mental health field. First, some theory. According to Teresa Fleming, applied games and gamification have potential to increase the impact of mental health internet interventions, and there are quite many ways how. By extending the reach of online programs to those who might not otherwise use them, by improving engagement through both game-based and serious motivational dynamics, and the third one is by utilizing varied mechanisms for change, including therapeutic processes and gaming features. We already know that there are games to use for mental health purposes. And now we know that there is a good reason to gamify already existing online services or other services. At the same time, is there a gap between this knowledge about gamification and everyday practice? What do you think? What about professionals' ideas and attitudes towards games, gaming, and game-based elements? I think there are quite strong prejudices and attitudes behind this phenomenon. And that is the reason why I will introduce few projects which targeted for using games within mental health field. The first trial was a mental health promotion project for students, and the idea was, please play serious games. Students had time during the mental health addiction and crisis nursing course to test and play different kinds of games. After that, their ideas how to use games to support studying and as a future working tool in mental health field were collected. It was quite surprising to find out that students saw lots of possibilities and really nice ideas how to use games in their future work. Of course, we can also see these little bit negative visions. If I have never been interested in playing any kinds of games, so I will not use them in my work either. What do you think? Is it so simple? Can we decide as individual professionals what we do or refuse to do? At the same time, there was this another project, Gain Health by Gaming. We interviewed mental health service users and professionals to explore their perceptions and experiences they had regarding the use of gamification in mental health care. Mental health service users felt that the most important factors promoting gamification were identifying the advantages of gaming and ensuring that the content of games was meaningful. With regard to hindering factors, they described the concern that face-to-face interaction with health professionals would be eliminated and that professionals would not approve of including game playing as a part of care. One service user highlighted that, "Do you really think that my own nurse would play online with me? No way." According to health professionals, the use of game playing in mental health care requires that the professionals have an understanding of the service users' routines and that the game content is carefully designed. Professionals recognize changes occurring in the work culture, and they are concerned about the adequacy of their own digital expertise. One informant described that gaming is nonsense and it's not a real work. Both groups considered it important that the games used in mental health care would be tailored to meet the needs of the clients and contain the appropriate content. What does this tell to you? In somehow, it tells that maybe there is a need to modify prejudices at the same time when we develop new games for mental health field. So, the next step was to test if it's possible to change the attitudes and to implement gamification into mental health services. So, few words about Get Involved by Gaming project, which was funded by EU and it was operating from 2015 to 2017. The idea of the project was to actively test and use digital serious and health games in mental health field. We wanted to switch the attitude from the narrative of negative gaming to the narrative of benefits and positive sides of the gaming. We focused to use the knowledge of service users and experts of experience to develop totally new kind of game-based services. And we were interested to reflect social and healthcare professionals' attitudes towards digital games and gaming. The project was targeted for adolescents and young adults, service users who already spent time with digital gaming. They were recruited from organizations which provided mental health services, but we did not ask any diagnosis. Trained experts by experience was one group, and we didn't require any gaming history from them. And the third group we required was social and healthcare professionals working in units providing mental health services, and gaming history was not required from them either. And what did we do? We organized workshops and invited all those before mentioned participants to the same room to discuss about gamification in a broad spectrum and to play games. All the workshops were planned beforehand, and after the workshops participants got homework to do. One example of homework could be like choose a game or mobile application that promotes your health and play or use it actively. And after that, reflect on how the game promotes your health. All the participants were interviewed at the beginning and at the end of the workshop process. And here you can see the topics of workshops. What are the serious games? What are we talking when we talk about gamification? We arranged game workshops and actively tested different kinds of games. We talked how games have helped people and what kind of research is going on. We discussed about advantages and disadvantages of gaming, or how to balance your weekdays by gaming. We did our own gamer motivation profiles and had this kind of health games workshop where we tested example exercise games and biofeedback games. We also had presentations about game development, and by the end of the workshop we made videos how to develop new kind of game-based mental health care services. So, is it possible to change preconceptions? In our initial interviews, the individuals who participated in the workshops recognized prejudices related to gamification. They described that participating in the activities felt initially challenging due to the novelty of the subject matter. The idea of equal cooperation between participants was considered an important principle and raised interest. Additionally, the participants expected to gain more information and skills related to gaming. In the interviews conducted after the workshops, the participants described expanding their sphere of experience in regard to gaming as a phenomenon. They felt that they had gained more information about gamification and it had opened up new perspectives and changed their attitudes towards gaming. The workshops were described as being empowering and strengthening the participation of all participants. Most of all, the fact that the participants all had different background was considered an asset. Here are some examples, as you can see. This was from professionals' interview. I suddenly realized that there is so much more than negative addiction behind games and gaming. One of our regular gamer said that it was interesting to see that some participants really tried to play and they had no idea how to use the gamepad. I hadn't thought that it might be so difficult to someone because it was so natural for him. And knowledge has broadened my thinking. I think I'm more flexible with this idea of gaming now. As you can see, the best part has been that people with so different backgrounds are gathered together to reflect this issue. And it was really important that those young adults who were avid gamers were the real specialists and they were the ones who guided the others to the world of games and gamification. After all this, it is important to remember that we are all different kind of gamers. And when we attempt to implement game-based interventions in mental health services, it is essential to recognize the different attitudes that both service users and professionals exhibit concerning games and gaming. And we really need to be open-minded. We don't have to know everything, but we need to be interested in what is happening around us. Thank you for listening. Hopefully you got some new ideas how to implement gamification in your field of expertise.